And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Doctor, give me the news. I got a bad case of loving you.
Well, good evening and welcome to Boomer Life here on CIL 650. The doctor is in the house. Perhaps musically you've heard a hint or two. Our guest on this episode of Boomer Life from YesWellness.com. Always a pleasure to welcome Dr. Paul Zickler to the program. Good to see you again, Dr. Paul.
Good to see you, and hyped up all by that oncoming music.
Little Robert Palmer,
yes.
get the toes tapping.
Exactly.
Okay, well, it's great to have you back with us. Remind our listeners a little bit about yourself. You're a resident of Crescent Beach now, living the good life down there near the water, but you've had quite a colorful and interesting medical career. You graduated from UBC?
No, Western.
Western
Yeah.
Ontario,
Yeah.
okay. But you came to BC and became an emergency room physician at one of the province's busiest hospitals, Royal Columbian in New Westminster, and ran the show there for close to 20 years.
That's correct. I interned at the Royal Columbian as well, and then they wanted me to stay, so I did. And so that was a very exciting time in my career. And
there was no such thing in those days as emergency medicine. It's a discipline now, but there was no such thing. You had to sort of make it up on the fly, didn't you?
it's exactly right. We were basically family docs who decided that there should be a doctor in the emergency department at all times.
Right.
Because of the increased acuity of people coming to the emergency department. If people that are listening can remember, probably, that's almost 40 years ago. The emergency department was basically, if you called your family doctor and you had something acute, you called the office and he'd come and see you.
Mm-hmm.
Or if he was in his office, he'd break away and come to see you in the emergency department. But many times you'd be busy doing things and wouldn't be able to come for an hour or two, and
Right.
people would be sitting there. So a couple of my predecessors, actually, family docs, had started doing that by the time they asked me to join the group after I interned. And it was very, very important that we did start the full-time emergency group.
Had you any idea, as a kid out of med school interning here in BC, that what were you thinking of becoming while you were interning? Because you didn't. I don't imagine you intended to specialize in being an emergency room physician, did you?
Absolutely not. I was going to be a family doc, and it just turned out that my first rotation as an intern was in the emergency department.
Right.
And I was totally, absolutely green. I had no experience in the emergency department. And, the first day I was there, the emergency, the fellow that was there said, Zickler, he said, I've got a couple of lacerations here for you to do. And I said, well, I haven't done a laceration suture job at all.
Right.
And he said, okay, come with me. He says, watch very carefully because
You get the next one.
Yeah, you watch me now. You do the next one, and then your partner that's coming tomorrow, you show him.
Okay.
So when you put under the gun like that, boy, you would pay attention.
Sure.
And that's how you get started. That's how we got started.
Mm-hmm.
And now, of course, it's a discipline. There are emergency medicine consultants and residents with a formal 4-year training program
Sure.
after internship. So it's changed dramatically.
After leaving Royal Columbian, after 18 years of dedicated service, you and a few colleagues operated a few clinics, so what are now known as wellness centers. You opened up in South Surrey, out in Langley, in the burbs around Vancouver.
That's correct, Sterling. Well, you get to a point. I think if in 18 years, I really did enjoy the medicine, and for me, there was no exception to the excitement and the feeling of involvement and the feeling of accomplishment in terms of helping people in dramatic circumstances
Oh, sure.
that the emergency department gives to a physician who likes that kind of medicine. But things were changing dramatically, and up until that time, the emergency department was a focus point of getting people into the hospital and treating acuity. After that point in time, the funding system changed in terms of the federal transfer payments to the
Right.
provinces, and the provinces were all of a sudden informed that the transfer payments weren't going to be to the magnitude they had been, and they had to look at severe cutbacks. And so then all of a sudden, the bed availability, the acute care bed availability started to be backlogged. The acute care beds started to get backlogged. And so by the time I was at 18 years in the department, all of a sudden our emergency department was full. There were people waiting in the hallways. There were people waiting in the waiting rooms. The ambulances were waiting in the back door where the ambulances go.
Sure.
The roles of the paramedics that we helped to develop wasn't in getting the people and treating them out when they were picking them up or at the traffic scene. It was taking care of people in the ambulance while they're waiting for them to get into the department.
Sure.
Of course, that puts a completely different pressure on you doing your medicine. You can do your medicine, but now you got to do patient management in terms of where we're going to put these people, where am I going to see these people.
Right. It wasn't as easy to find a bed for someone who
That's
obviously
right.
needs one,
That's
being
right.
pretty banged up after a traffic accident or something.
Yeah. So you were basically, your job description now included bed management. And,
Right.
And not only, but did that put pressure on you in terms of who's going home and when they're going home and how quickly they're going to go home.
Right.
Arguing with families saying, listen, he's not that sick. There are 3 other people that are worse than he is, and people saying, I can't look after him, I can't take him home.
Sure.
And that kind of stress really came to a head one evening when I saw a 17-year-old motor vehicle accident victim who came in, and she was very severely traumatized. She had a fractured pelvis, fractured long legs. She was paraplegic from a spine fracture, and we stabilized her and looked after her. Now that was about 11 o'clock at night, at the beginning of my shift. I started looking for a bed for her at that time. And I was still there after my shift ended at 8 o'clock. I was still there at 10 o'clock in the morning until I finally finalized a bed. And I had to basically get on my hands and knees and ask a first-year resident at VGH to beg him to take this patient to a facility where she would get the care that's what she needed.
Right.
And so I was looking after her all night, as well as the whole other department. And when I got home from that, I said to my wife, you know what? I can do my medicine, but I can't take this pressure of this backlog and looking for beds and dealing with the stress of trying to place patients.
Sure.
I'm going to be looking for something else to do. And so when I finally came out to my group of colleagues, they all looked at me and said, wow, you're going to do that. And then 4 of them decided to go with me.
Okay.
And they had sort of similar feelings but never really voiced them. And so then we opened up our first clinic out in Langley, and we basically built a concept of a small emergency department to sort of look after the quick acute injuries, so the lacerations, the simple fractures, things that people wanted to see the doctor that day but couldn't get in to see the physician.
Right.
Instead of going to the emergency department, they would come to the clinic, and then we would refer them back into the community.
Right. Taking pressure off the emergency departments a little bit.
We hope to.
And in the process, of course, you and your colleagues are all former emergency docs, so
Yeah.
it's right up your alley.
Exactly, and it really worked well until sort of caught up with us. So the good quick service of people being seen and being dealt with sort of snowballed it because people, when in their follow-up, couldn't get to see the doctor in a timely fashion, or they simply said, the heck with that, I'm not going to make an appointment, I'm just going to walk in today because
Sure.
today I happen to be by here and my sutures had to come out. So then it sort of got more muddied in terms of the cuteness and what we're supposed to be doing, and over the years, of course, now those walk-in clinics have morphed into being family practice clinics
They sure have.
with walk-in spaces
Right.
to see people, and I think that's it's a good thing in terms of continuity of care, but still there's a lot of backlog of all these people that could be seen. And you're seeing now with the development of the new emergency departments, like for example the new department at Surrey, where there is this sort of sicker, more intensively ill people, and then a whole area for walk-in wounded patients to
Right.
get them in and out quickly. And hopefully that the way that family practice clinics are being organized, that they're leaving room for walk-ins so that people feel comfortable in going to their designated clinic and be seen when in a timely fashion.
At what point in your career did you, and I hate to use the word discover, but did you connect with the internet? Because there, you got into you came to a point where you actually became a dispenser of prescriptions on the internet. This would be a decision, a fork in the road that many years later would lead to the creation of YesWellness.com, which is what you're here with us today to talk about.
That's right. That's one of the twists and turns of everybody's career. You see opportunities and you see sort of events that are happening, and it changes somewhat your course of career. So while we had these walk-in clinics, one of them we opened was near the border in South Surrey, and we had a patient that came to visit from Seattle, and she saw my partner, and she had actually visited. She was visiting, and she needed some tamoxifen, which is a breast cancer medication.
Okay.
And so the doctor, my partner, assessed her, and then gave her a 3-month prescription for tamoxifen. And so she went to the pharmacist, and an hour later she came back into our clinic, and she was crying in the waiting room, wanting to see the doctor again. And the nurse said, "Certainly, is there any problem?" "No, I just want to see the doctor." So she put her in an examining room, and my partner went back to see her, and I said, "What's the problem?" She said, "Doctor, I just wanted to let you know that I just went to get a 3-month supply of my tamoxifen, and I want to let you know I've only been taking a quarter of the pill because that's all I could afford.
Okay.
I'm on a fixed income. So here, I got my 3-month supply, and I can afford to take one a day instead of a quarter of a day. Plus, I've got $300 left over." And so you can imagine the difference in price. There was an 80% difference in the price, on top of which she got the benefit of the currency exchange at that time,
Oh, of course.
which was $1.65.
That's right. Yes.
So she was beyond elated.
So those were tears of joy.
Absolutely.
Sure.
And so she was so impressed with this arbitrage that was there that she went to see the Seattle Times. And the journalist there was quite keen on her story. And one thing led to another, and the next thing they were contacting my partner. They did an interview and did a full-page expose of this arbitrage.
And that would be a huge story, the dramatic difference in Canadian drug prices for exactly the same product in the United States.
Exactly. And it's amazing how long that existed. No one had paid any attention to it.
So your little South Surrey clinic suddenly became full of visitors from south of the line, recognizing the ability to see quality medical professionals and get their prescriptions at super discount rates.
Right. Well, so then we got so busy doing that with all kinds of media, national media, both on both sides of the border, that we opened a clinic just for Americans only.
Okay.
Because our waiting room was being inundated with all the Americans.
And the local people getting a little looking down their nose.
Well, yeah, and I can understand. You can
Well, sure.
understand that
Of
for
course.
sure. And but what was really interesting was that sort of the decision making in making this decision of opening this this clinic for Americans only, because my partners were wondering, well, what are we doing this for? And when we really sat down and thought about it and said, listen, think about the people that were coming, and probably 95% of the people that were coming, maybe even 98% of the people that are coming, were seniors on a fixed income,
Right.
a limited income, people with disabilities
Mm-hmm.
that were not able to afford their regular medications. Some not taking it at all, some taking every day of the day, or whatever.
Sure.
And I said, if the tables were turned, and they could go to Bellingham and get their prescriptions at 80% difference in price, would you not hope that someone would help them? And so that was the decision.
Okay.
And so then we started. It was very busy until 9/11, and all of a sudden borders were closed. People
Right.
couldn't come get their medications. They couldn't come to see us, and people kept on phoning and said, "Well, why can't you mail them?" And I said, "Well, the Postal Service, both here and in the U.S., said that's illegal."
But then you checked a little homework with the U.S. Postal Service and found out, well, maybe not quite so illegal after all.
Well, we started going on the internet and looking, and there were a couple of internet pharmacies from Winnipeg
Yes.
that were delivering their parcels to the U.S. So then we said, well, that's strange. Let's go and see the FDA and get a clarification. So we did. We went to Bellevue and into the FDA office, and we were out in 10 minutes. They gave us a piece of paper that said, we are allowing parcels of medications to go through if you follow these instructions. Basically, they had to have a personal prescription from their doctor after a face-to-face encounter.
Sure.
That it was
The usual safeguards,
yeah, personal use,
Not for resale, exactly.
not for resale, and no narcotics.
Right.
And said customs are going to let the packages go. So that started us on the internet. So quickly, we got on the internet and started drsolve.com. And it just so happens after that got rolling for a few years, my daughter became a naturopath. And it sort of steered me into complementary medicine and all of the different approaches and the different products that they were using to create
and
wellness.
let me stop you for just a second, because back when your daughter was considering this career, and complementary medicine is how you refer to it now, but you will at least admit that back in the day it was referred to sometimes rather snidely by the medical establishment types as alternative medicine, and they said that almost as a pejorative.
Oh yes, for sure. Yes. It was the knowledge base in terms of information that conventional doctors had towards complementary medicine, healthcare people was non-existent.
Pretty dramatic turnaround. What year did your daughter decide to become a naturopath?
That was in the 80s.
Yeah. Okay.
Yeah.
So a lot of changes in the mindset of North American docs as a group, even in that 25, 30-year period since, right?
Yep.
Rather remarkable. And you're a good example of all of that. Our guest from YesWellness.com is Dr. Paul Zicler. And when we come back, we're going to do something we only got halfway through last time. Dr. Paul, on his website, YesWellness.com, has fantastic information. And one of the items is called 10 Things to Throw Away for Better Health. And we saved it, well, last time around, too late in the program. We only got the first 5 done. So when we come back, we'll finish off our guest's story, and we'll find out more about YesWellness.com, and then we'll do, this time for sure, all 10 on the list of things to throw away for better health. After this quick timeout on Boomer Life on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.